Well, when it comes to India and the Netherlands, we have seen the close partnership between the two countries. We have also seen repatriation flights starting from the country. With me is the Indian envoy to Netherlands. So welcome to Wion, and it's great to speak to you. So my first question to you is talking about the repatriation flights. We have seen the visuals. So if you can talk about the flights which have started from Netherlands to India.
Well, Sidhant, just 2 days back, we managed to use the services of KLM to send around 270 passengers from here back. A large number of them came from Latin American countries, from Mexico and Peru, as well as Portugal, from where people have not been able to go back. And around 170 people from the Netherlands also joined them. This was a flight which was headed to Mumbai. So this is virtually the first group of passengers to go back to India after nearly 2 months of lockdown. And it took a lot of effort and coordination and facilitation between the Indian missions, with the Indian government in Delhi, as well as with KLM. But we are very happy the passengers have reached safely. They have gone into quarantine. We are very happy, and we are already working on the next options of sending more people to India. We have around 1,000 people who are waiting to return to India for a variety of reasons. We hope we will have an Air India flight which will go from here on the 8th of June to Delhi. That will take a large number of passengers. We are trying to see if we can get another Air India flight to South India, to a destination in South India. We are waiting for confirmation regarding that. We are also exploring if we can use more KLM flights to go back to India.
Mhm. Talking about how the Indian mission has been reaching out to the stranded Indians there in the country. If you can talk about that, the helpline numbers, perhaps shelter, accommodation, something which has been the top priority of every mission, whether the country is impacted or if not, the country is not impacted, like in Mongolia. While there are not many cases, the mission is taking care of the Indian stranded. While if you look at China, which is one of the worst impacted countries in the world, the mission is reaching out.
That's right. Well, number one, the Netherlands is home to the largest community of Indian origin, Indians as well as Indian origin, if you take in all of European Union post exit of UK. It was number two after UK in Europe. So there is a large Indian presence here. On top of that, Amsterdam is a very important hub. Schiphol Airport and KLM is a service which connects India, used to connect India 3 times to 3 destinations, Delhi, Mumbai, and Bangalore, almost on a daily basis. So when the lockdown began, we had a large number of Indians who got stranded here. The first effort we made was to try and send about 115 Indians who came from Latin America and North America, who got stranded at the airport without being able to come into Europe, go to India, go back to North America. So we had to, for almost 2.5 days, they were stranded at the Schiphol airport. We had to look after them. One of them included a pregnant lady whom a member of the embassy had to take to a local hospital because of some emergency reasons. So our staff was fully at the airport looking after these people. The airport had virtually shut down by the time. And we worked very closely with KLM, and we finally managed to put them on a KLM flight and get special permission for them to enter India. After that, we still had about 51 people who were stranded, who were mostly people stranded in Europe who had come here as tourists or for visiting relatives or for various other reasons. We also had, we still have a group of 20 people who were workers who lost their jobs during the crisis. They were dismissed by their employers, and they were without accommodation, without food. So all these 51 people the embassy has been looking after. A small portion of them who were headed to Mumbai, we were able to put them on the KLM flight and send. The remaining we hope to send to Delhi as soon as possible. And from Delhi, they will make their way to onward destinations. But beyond that, I mentioned that there are about 1,000 people who are waiting here. And the embassy from day one has been working 24/7 to connect with them and to connect with the community at large and to make ourselves available to them. Because of the local restrictions as well as the advice from India, because of the fear we didn't want an infection to come into the embassy, we were all working from home. We were working through online means. We were coming into the embassy only when absolutely necessary. But we continuously provided our contact numbers. We made them available. We were on. I gave a large number of video messages. I interacted through various social media platforms, through WebEx, through Microsoft Teams, through Skype, with different sections of the Indian community. Our goal was to tell them, don't worry, if there is a crisis, we are here for you. You can contact us. All you need to do is send an email to us. We will come back to you. And we wanted to boost their morale. People were broken-hearted that they couldn't go back. Many of them had financial problems. Many of them had mental stress. We have a large number of Indian students here in the Netherlands, about 3,500. They understandably are very young. And also because their education had shifted online, the universities were shut down otherwise. So they were very anxious to go back to India. We try to help them in whatever way possible. So there has been extensive outreach to the community, predominantly through online means of every kind. But as an embassy, we have made it a point to be available full time, irrespective of whether it's Saturday, Sunday, day or night. Anybody could reach us at any time, either through Twitter or through Facebook or through an email or through a phone call. And we are very happy to say that our proactive approach in this regard has been noted by the community and is well appreciated. Even the Dutch Foreign Office expressed its appreciation, saying that we are very happy Indian Embassy is playing such an active role. We also have worked very closely with the Dutch government in helping them bring their nationals who were stranded in India back from India, and in providing visa extensions and other services which our community required from the Dutch government. So overall, let me say that now, while in India the numbers are still going up, in the Netherlands the numbers have been steadily coming down. The government has already announced a calendar of how they will progressively liberalize the restrictions which had been imposed all the way up to September 1st. More and more people are going out. From the 1st of June, restaurants will open with a maximum of 30 people, observing social distance. So we are trying to ramp up our machine and go back to normal as possible, even through this crisis period. While our priority was stranded Indians and was keeping in touch with our Indian community, we have also started an outreach to business community of both sides. Indian companies who have investments here, Dutch companies who have investments in India. We have tried to see how we can be of help to them, what problems they are facing with supply chains in India or locally here, and also talking to the business community about India-Dutch economic relations and how we face the post-COVID world. What is the outlook that we see? What is the scenario that we see? And how we can all work together in partnership to take this, to continue to ensure that this relationship grows steadily.
But talking about the Indians, you extensively talked about how the mission is reaching out to the Indians who are stranded. Any Indian who has been infected with COVID?
In the Netherlands, they have not tested everyone. They have followed a policy where the focus is exclusively on the elderly and the most vulnerable. So testing has been restricted to predominantly health workers and those who need it the most. For the majority of the people, the advice has been rest at home, take paracetamol. It will come like a flu or an influenza and go away. So the actual number of infected figures, we have infected figures which are released regularly. The total figures, or the most recent figures, stand at about 45,445. And the deaths are around 5,830. But specific infection figures as to how many Indians have been infected, we don't have. But we know by, personal accounts from people that many people would have had it and have recovered already. We have only one case of one fatality of an Indian citizen who had other complications also, and who was married to a health worker. It is not clear whether he actually contracted the virus and it was because of the virus he passed away, and whether the health worker was asymptomatic. She had picked up the virus from the hospital and then it went to him. But either way, the embassy played a very active role in supporting them and in helping the spouse cremate him here as per the COVID norms. So truly, we have only reports of one fatality.
So my last question to you is how both the countries are cooperating when it comes to vaccine development or perhaps research, or the fact that containment models have both the countries talked about the containment models, about the best practices both the countries are using even as the pandemic spreads across the world?
Well, I have to say that, the health ministries on both sides are entirely focused on handling their domestic situations at this point. There has not been much contact between the governments on the health field yet, though we are trying to start that process also, depending upon the time available to both. But we have already had contacts between the commerce ministers of the both sides, Commerce Minister Piyush Goyal and Minister for Foreign Trade Sigrid Kaag. Had a telephone conversation. And on June 4th, the foreign ministers of the two sides will speak to each other. And in private sector, Serum Institute of India, which is the largest producer of vaccines, has a subsidiary here in the Netherlands called Biltoven Biologicals. The company is currently engaged in producing BCG vaccines as well as polio vaccines, and it has a extremely modern facility. But now that the COVID crisis has happened, they are also turning towards research on vaccines and seeing how collaboration can be made. Similarly, Johnson & Johnson has a very major facility in Leiden, which is being funded by the US to rapidly expand research into a COVID vaccine. We have, on our part as an embassy, been reporting all developments here in the Netherlands relating to both vaccines as well as medicines and treatment protocols, research into whether HCQ will work, whether BCG vaccines will work. All this information we have been feeding regularly to the Ministry of External Affairs in India as well as other authorities. And we hope we are waiting for responses whereby we can build bridges of cooperation. And the Netherlands is a leader in innovation. The Netherlands is a leader in science and technology. Healthcare is an extremely important subject for both. Netherlands is home to Philips, which is one of the largest healthcare providers today in the crisis time. They are rapidly ramping up their production of ventilators. They already manufacture a lot of health equipment in India, and they have announced fresh investments of around $50 million to ramp up their production facilities in India. We see all this as areas where we have great scope for further collaboration in future. We had the Dutch health minister visit India twice in the last 3 years, along with Dutch Prime Minister Mark Rutte and along with their King and Queen. He has traveled all around the country and they have been very impressed with the medical facilities in India. The two countries have been collaborating on on fighting against what is called antimicrobial research into antimicrobial bacteria. So we already have the basic collaboration. We have had delegations come from India to the Netherlands in the field of digital health. We are also trying to focus startups in both countries into the health sector. So there is a great deal of activity, and the leading medical centers in the Netherlands, like the Erasmus University Medical Center, like the Amsterdam Medical Center, like the medical centers of Maastricht University and University of Groningen, have all already collaborations with various players in India, government and private. And we hope all these collaborations can be consolidated and strengthened to build further bridges of cooperation, both to handle the COVID crisis as well as in healthcare in general. I would also like to mention that Ayush has been a very major area of focus. We have had large-scale international Yoga Day celebrations in the Netherlands in the most prestigious venues like Museum Plein of Amsterdam or like the Dam Square of Amsterdam. This year, unfortunately, because of social distancing norms, it will have to be an online celebration. But we have also had a number of events related to Ayurveda. We have had the Ayush minister visit here for an international conference and interact with the health minister of Netherlands. We believe that Ayurveda can contribute to building immunity. We believe that Ayurveda and yoga can be of tremendous benefit to a society like the Netherlands, which has a large elderly population, which is an aging society, to improve wellness, to build immunity, to reduce health costs. One third of their budget goes to healthcare. And health costs is a very major concern for the Dutch government, how you can provide quality care at a reduced cost. And we think Ayurveda, yoga can help in all this just as much as the Indian health sector. Our doctors, our nurses, our pharmaceutical companies, and all our service providers in this field.
Mhm. Well, thank you so much.
Not to mention the research labs that you talked about.
Yes, sir. Sir, thank you so much, sir, for speaking to Wion and talking about how both the sides are cooperating, especially at a time of this pandemic, something which has been a global worry, and we have seen the toll is still rising, and we have seen not only Netherlands and New Delhi coming together in terms of their talking points, and of course, as you talked about the repatriation efforts, but also Europe and India. Thank you so much, sir.
Thank you, Sidhant. Pleasure talking to you and to Wion.